You fell asleep on your right side last night. Or maybe you were flat on your back, mouth open, snoring away. Or curled up like a shrimp on your left. Here is the thing nobody told you. After 60, your heart is working differently while you sleep, and the wrong position is making it work even harder. Today, we are going to talk about exactly what is happening to your heart while you sleep and what you need to change. Hello, my friend. Welcome back to the Untold with Mary. I am really happy you clicked on this one today because this topic came up so many times in my conversations with seniors just like you. Chest heaviness at night, waking up breathless, that strange pressure on the left side. And every single time I ask, nobody ever thought their sleeping position had anything to do with it. Today, I'm going to walk you through everything, what each sleeping position does to your heart after 60, why your body reacts the way it does, and the simple changes that can actually help. This video was made for you, so stay with me. Let me start with the most common one. Sleeping flat on your back. So many people think this is the correct way to sleep. Perfectly straight, arms at the sides, very proper, like you are practicing for something. But here is what is actually happening inside your body when you sleep this way after 60. Your tongue and soft tissues in your throat relax and drop backward. This partially blocks your airway. Your breathing becomes shallow, your oxygen levels quietly dip during the night, and your heart, which is already working harder than it did at 40, now has to pump with less oxygen in the blood. That is extra strain every single night. And a lot of seniors sleeping on their back are also dealing with acid reflux, that burning feeling that creeps up at night. You think it is what you ate for dinner, but sometimes it's just the position your body is in. Now let us talk about the right side sleepers. This one surprises people. Sleeping on your right side actually puts direct physical pressure on your heart. Your heart sits slightly to the left in your chest. When you roll to the right, your other organs shift and compress slightly toward your heart. Over time, this matters more after 60 because the heart muscle is less flexible than it used to be. Right side sleeping is also linked to increased acid reflux at night. So if you are waking up with that sour taste in your mouth, your sleeping position could be a big reason why. Now here is what I want to ask you right now. Which position do you usually sleep in? Tell me in the comments below because I genuinely want to know, and your answer might help someone else reading those comments too. Let us talk about the curled up position now. The full fetal curl. Knees pulled up tight, chin down, all rounded up. Comfortable, yes. But when you curl too tight after 60, you are restricting your diaphragm. That is the big muscle under your lungs that helps you breathe deeply. When it cannot expand properly, your breathing stays shallow all night. Shallow breathing means less oxygen. Less oxygen means your heart compensates, and that compensation, night after night, adds up. Now let me explain why all of this hits harder after 60. And I want you to really hear this part, because understanding the why makes everything else make sense. When you were younger, your cardiovascular system had what I call reserve capacity, extra strength, extra flexibility, extra tolerance, like a car engine that still runs fine even when you push it a little. After 60, that reserve shrinks. The heart walls become slightly stiffer, the blood vessels lose some of their elasticity, the nervous system that regulates your heart rate during sleep becomes slower to respond. So any extra pressure, any oxygen dip, any positional strain that your body used to absorb quietly now actually registers. There's also something called the autonomic nervous system. This is the system that runs your heart rate, your breathing, your blood pressure, all without you thinking about it. During sleep, this system shifts into a specific mode, and your sleeping position directly influences how smoothly this system works. Back sleeping and right side sleeping can trigger small disruptions in this system. Your body is basically sending quiet alarm signals all night, and you wake up feeling like you did not sleep at all. That morning tiredness, that foggy head, that heaviness in the chest, now you know where some of that is coming from. So what do you actually do about this? Let me give you the real practical answers. The single best position for your heart after 60 is sleeping on your left side. I know. Some of you are already thinking, Mary, I have tried that and I cannot stay there. I hear you, but here's why it's worth trying properly. When you sleep on your left side, gravity actually helps your heart. The aorta, which is the main artery carrying blood from your heart, curves to the left. Left side sleeping allows blood to flow more naturally through it, less effort for your heart, better circulation while you sleep, and it significantly reduces acid reflux at night because your stomach sits lower than your esophagus in this position. Now, if left side sleeping feels uncomfortable, here's what helps. Place a firm pillow between your knees. This takes pressure off your hips and lower back and makes left side sleeping much more comfortable. A lot of seniors tell me this one small change made a huge difference. If you have tried left side sleeping and your shoulder hurts, your mattress might be the issue, not the position. A softer pillow under your head and a slightly firmer mattress support makes left side sleeping much more sustainable. Now, for those of you who absolutely cannot give up back sleeping, here is the adjustment. Elevate your upper body slightly. A wedge pillow or 2 regular pillows stacked so your head and chest are slightly raised. This simple change reduces the airway collapse that happens when you sleep flat. It reduces acid reflux and it takes some of that pressure off your heart. Have any of you already tried sleeping on your left side or using extra pillows at night? Drop your experience in the comments. I read every single one, and your story might be exactly what another senior needs to hear today. For the curled sleepers, the fix is simple. Keep the side position, but loosen the curl. Straighten your legs slightly so your diaphragm has room to breathe. You do not have to sleep like a soldier. Just give your lungs a little space. Before I let you go today, I want you to remember one thing. Your heart works for you every single minute of every single day, including all night while you sleep. The least we can do is give it a little help by choosing the right position. Starting tonight, try your left side with a pillow between your knees. Just try it. Small change, real difference. If this video opened your eyes today, please share it with someone you love who is over 60. They need to hear this too. Subscribe so you never miss what Mary uncovers next. Take care of that heart, my friend. I will see you in the next one.